In today's episode, we're going to take you higher. Yeah, I know it's a bad pun, but today's episode, we're going to be talking all about medical marijuana. You know, you thought about it, you know, you want it.
Welcome to the What Up Doc University podcast, your number one resource for total body wellness. Here's your host, Dr. Mike.
Hey, everybody. Welcome back to the What Up Doc University podcast. This is Dr. Mike coming to you from my living room. A little bit of changes in the household. We actually rearranged the recording room and changed that into my oldest son's bedroom, I guess, as it should be. And I'm forced to find new areas to record the podcast. So here I am recording in the living room again. And we've been having such a great time. I've been getting a bunch of brand new guests reaching out to be on the show. And today is one of those guests that, it's some amazing content. And I was really, really surprised when we did this interview because, this topic of medical marijuana has a lot of myths. And that's why I wanted to do this show, for you guys, is to kind of dispel some of those myths and give you guys a little bit more information. So today's guest is Dr. Patel, and she's been practicing in the area of medical marijuana for about a half a decade now, since 2012. And what she does is she walks her patients through a step-by-step approach for medical marijuana for the specific medical condition without getting high off of it, because that's one of the things that people get concerned of is I don't want to be taking this medical marijuana and be walking around high all around and becoming addicted. And I don't want to be smoking it. Those are some of the issues that some people run into. And she speaks, and she's treated thousands and thousands of different patients using research based on medical marijuana. She completed her medical studies at, I may pronounce this wrong, but Touro University College of Osteopathic Medicine in California, and her undergraduate studies at Northwestern University in Illinois. And you can learn more about her at www.drrachnapatel, drrachnapatel.com. And I'll have all of those in the show notes. So sit back, relax, take out some notes, open your mind, and let's dive into the world of medical marijuana. So we got another guest for you guys today. And today we're diving into the taboo zone that a lot of people, they kind of stay away from, but that everybody's thinking about this. And today we have Dr. Patel on the show to talking to us about medical marijuana. And she's gonna share some interesting things. I got to see some of her YouTube videos, and it really opened my mind up to the medical uses of medical marijuana and some of the myths surrounding it. So welcome to the show, Dr. Patel.
Yeah, thank you for having me.
Oh, yes. So let's start right in. Tell us about your background and how do you get into this field of medical marijuana?
Yeah, so it's a funny story.
I bet it is.
So my background is actually in emergency medicine,
Okay.
right? And as I was going through training, there were a couple of cases that sat really heavy with me. I was treating countless overdoses on prescription pain medications, especially opioids. I was seeing a lot of drug seekers that were trying to finagle prescriptions out of doctors to sort of feed their addiction.
Mm.
And then in my toxicology rotation, the whole purpose of this rotation was to treat overdoses on prescription and over-the-counter medications.
Yeah.
So, you take a step back and it's like, all right, what exactly am I doing here? Because the very things that I'm prescribing, I'm then having to treat overdoses for.
Is that a big problem? Like, I hear a lot about this in the news and all that. But did you find that that was a big problem? This problem with opioid prescription overdoses or abuse?
Yeah, huge problem. And you see it a lot in the emergency room, because you're not the doctor it's a system that's easy to take advantage of from an addict's perspective, because there's a different doctor every time you go. Sometimes you can see a patient's previous records, and it's indicated on there that this patient may be seeking drugs, but no, it's definitely a huge problem, and something that you kind of, whenever you're taking a history, you have in the back of your mind.
So you're seeing this as a problem, and then how did that lead you to where
Okay,
you are
so
today?
at the same time, I was overworked one week. I think I had worked like 90 hours
Oh
in a
my
period of
gosh.
5 days, and I was wired. I couldn't sleep. And so what was I doing? Like most other people do, I was browsing the internet. I was on Craigslist, and I was browsing around on Craigslist, and I happened on an ad that said medical marijuana doctor needed.
Mm.
So definitely piqued my curiosity, right? So I started looking into it. I didn't know the field had existed at this point in time. So I started looking into the field. I started looking into, reading up on the science behind medical marijuana, the research behind medical marijuana, and basically just hung out on PubMed. And about a year later, I was definitely compelled by the research in that I saw its potential to treat chronic pain. As I definitely knew that as it stands, even currently, that we don't have a good solution for chronic pain, and this definitely seemed like a good solution. So, with on your quest to become a good physician, a big component of that is to gain clinical experience. So I decided to work at a medical marijuana clinic in Sacramento, and that's really where it all started.
So I want to go back to when you were looking at the Craigslist ad. Why did that pique your interest? What was it about that?
That's a tough question. I just didn't. You'd always learned about marijuana as a drug of abuse,
Right.
and to see it being used medically, that's what piqued my interest, right? So I think in the medical world, we tend to be very black and white
Sure.
about, oh no, that's a drug of abuse. This is a drug that's used for medical purposes, even though it's a very gray area, right? And so that's essentially what piqued my interest. It's like, okay, this is really considered a drug of abuse, but it's being used medically. So that was it. It was that change, that shift in perspective.
So they piqued your interest, and then you started, you're jumping all over PubMed. What were some of the research studies and findings that really opened your eyes? What were some of that stuff that you found?
So there was this one study. One of the authors of the study was Dr. Donald Abrams, who's well known in probably worldwide. He's an integrative oncologist, and he did his background is also I think he also did work in the area of HIV.
Okay.
And he was doing research on medical marijuana. And one of the things that him and his team looked into was the use of medical marijuana and opioids together. And in that research study, what they found was that medical marijuana helped to reduce the use of opioid medications. Typically, what you hear of when you think of opioids, and what you see as a physician, is that a lot of times patients end up very quickly becoming tolerant to lower dosages, needing higher dosages and higher strengths of the opioids to help relieve their pain. So this is definitely very what's the word? It was eye opening that, here's a
Yeah.
medication that's helping to reduce the use of opioids. So that was definitely a study that, helped to change my perspective on medical marijuana.
So, in your opinion, why do you think that marijuana has gotten such a bad rap? I mean, you look at the laws today, and it's leaning more towards you see a lot of states legalizing marijuana, but yet it still has such a bad rap. It is still that like you said, that gray area, that taboo subject. Why has it gotten such a bad rap?
So there's a historical context to
Hmm.
it. Up until 1937, marijuana was actually sold over the counter as a medication at pharmacies. And then what happened was you had the Great Depression going on.
Hmm.
This was during the 1930s, and then at the same time, you had a migration, a big migration of Mexicans into the United States. And then the third component of this is that there was a politician named Harry Anslinger, who was known to be a racist. But there's that component, and then with the Great Depression, there was sentiment that, hey, here we are as Americans, we're jobless, and here are Mexicans, with jobs in America working in the fields.
Mm.
Now, the other component of it was that in Mexican culture, it was common to use marijuana recreationally. So what ended up happening was that Harry Anslinger instituted an exorbitant tax on marijuana, that if you wanted to grow it, to use it, you'd have to pay this tax. And in modern day, it would be the equivalent of 10 to 20 grand. And that's not a small sum of money even today. So basically, essentially, it deemed marijuana illegal if you didn't have this proof that you paid this tax. And then fast forward to the Nixon administration.
Hmm.
That was around the time when they instituted the Controlled Substances Act. And that's officially when marijuana was deemed a Class 1 substance. And Class 1 means that it's believed that it doesn't have any medical value and that it's highly addictive.
Oh, okay.
So that's sort of the historical context of it. And then, you move forward to the Reagan administration. This is when, there was this spike in cocaine across the world, cocaine use across the world. And so there's this whole campaign to say no to drugs. Marijuana was always included as marijuana was believed to be the gateway drug that led
Right.
to the use of other drugs. So it's very historical. Now, the motivations, a lot of times, they've been economical, they've been political. They haven't been always motivated by health risks versus health benefits.
Gotcha. So when it was classified as a Class 1 drug, was there any type of clinical studies or just scientific studies on the medicinal properties of it at that time?
At that time, well, here's what I can tell you.
Yeah.
The group that studied marijuana so far has
Mhm.
been the National Institute on Drug Abuse. So they've studied it as a drug of abuse.
Yeah.
They haven't studied it as
So they're coming
sub-
from a biased standpoint
Right.
already.
right,
Gotcha.
exactly. Yeah. And so a lot of the population that they're studying are typically heavy users, users that are using it specifically to get high off of. What we don't have enough information on at this point in time are the medical users, which are using it in a completely different way, right? So same thing with opioids. People who are using opioids for medical purposes are using it completely differently than people who are using it as a drug of abuse.
Gotcha. I mean, if you look at it, I mean, they should do the exact same thing with sugar. I mean,
Oh, yeah.
right? Like
Agreed. Yeah, completely.
it's like sugar kills way more people than a lot of these other drugs do.
Yeah.
But yet, it's not looked at it that way.
No.
So, in your findings, you've done all this research. What did you initially start using it for, and what have you found since starting up this? What have you found it the most useful for?
Okay, so when I initially started, I worked at an established practice. I
Okay.
think this practice was around for a couple of years. So they had patients that were they had returning patients, right? And so these patients were coming in for things like chronic pain, which I had read about. They were also coming in for insomnia, for anxiety,
Hmm.
for seizures. A lot of cancer patients were coming in. For appetite stimulation and to help suppress nausea and vomiting that was going on. So, overall, the three main conditions that I end up treating in my practice are chronic pain. And that's a pretty wide umbrella, includes conditions like fibromyalgia, arthritis, a lot of times back pain from herniated discs, from degenerative disc disease. I also treat anxiety and insomnia. Those are the most common conditions that I treat. And then, like I mentioned, I also treat cancer patients for side effects of chemotherapy. Then there's also multiple sclerosis patients as well. Um, uh, and then within anxiety falls things like PTSD,
Hmm.
ADHD, OCD. So subcategories of each of these conditions as well.
So what are the major forms of delivery that you're using for these patients? Are they smoking it, or are they eating it, or what form of delivery?
Sure. So I advise my patients not to smoke marijuana because
Okay.
long term it does do damage to the lungs.
Okay.
There are multiple different alternatives that they have that are much healthier. So vaporization is one. And basically, what this is that there's a device known as a
Hmm.
vaporizer, and it heats what's in it rather than burning it, right? So what you're avoiding is the combustion reaction that creates hydrocarbons when you're burning something, when you're smoking something.
Hmm.
So that's one option. Second option, there are edibles. So typically these are chocolates and gummies, but the industry's evolved enough now where there are sugar-free options, there are gluten-free options, there are vegan options. So they are moving forward in the direction of having healthier and healthier options available in terms of edibles.
So do do people need a prescription, and is it legal?
So it's going to vary
Okay.
depending on the state that you're in.
Okay.
Okay. So we have a couple different things going on in the United States. One is that we have now 8 states since the last election that have legalized marijuana for recreational use. Usually it takes about a year or two for these states to actually implement the whole system before everything gets started. The states that have actually implemented it and where it is actually uh, you know, functioning under the system of being recreationally available. So
Hmm.
those are Colorado, Washington, Oregon, and Alaska. In these states, pretty much you can just walk into a dispensary, almost like a liquor store, and you can basically purchase what you'd like.
Mm. Okay.
Then there are states in which marijuana has been deemed legal for medical use. Okay.
Okay.
So in these particular states, the way the system works is that you do need to see a physician. And then typically, in California, this is not the case, but typically you then have to submit your paperwork to the state. And I believe they have an independent physician who then, looks at your paperwork, and then approves that this patient for the use of medical marijuana. They then issue a card through the state, and then you can go to a dispensary. These are licensed facilities through the state, and you can purchase the medical marijuana. And then third category are the states in which it's neither recreationally nor medically legal.
And so let me jump to that one. What if a person um, is in those states and say they go and see their physician and their physician recommends it? What are their options then?
If they reside in a state where it's medically and recreationally not legal,
Yep.
is that what you're asking?
Yes.
They don't have much of an option at that point because you'd be breaking the law if you did use it. You are liable to the laws that your state has in place.
So say they were recommended by their physician and they left that state and they came to the state where it was legal. but they're not a citizen of that state. Oh, I don't know.
Yeah.
Is that
A resident. Yeah.
is that legal for them now to partake in that?
Sure. So the way the system works currently is that your physician has to be licensed in that particular state, and the paperwork that's issued to you is only valid in that state.
Gotcha.
And most states do have a residency requirement that you do need to be a resident of that particular state to participate in the medical marijuana program. So, say, a patient came to see me and they were a resident of the state of California, and I issued the documentation to them. But then, they were traveling to a state like Alabama, and their documentation is not going to be valid in that state.
Interesting. That's such a weird thing because, right? It's like saying, you got prescribed Vicodin or something, and it's, you went to one state and you can use it there versus another state that you can't.
Yeah, it's like a driver's license, essentially.
Gotcha. Now, what's your thoughts on this whole movement where, they're legalizing it in some states and other states are pushing back against it, but then an overarching, you look at the federal laws, but they're all not in alignment. What's your thoughts on all of that?
So here's the thing. I mean, I think the way it's classified federally, it's doing a disservice to the citizens of the United States because what it's impeding is research.
Right.
And what we really need, I mean, clinically, I'm seeing tons of evidence, but I would love to see more objective data. More objective information to be able to say with 100% certainty that yes, marijuana, I can say with certainty that with this percentage, you are likely to reduce your pain by this amount. The other thing is that we don't have sufficient information on a lot of the basic science of marijuana, like the first of all, the chemical compounds in marijuana, what exactly it's doing in the body. Most of the research that we have is based on research done in animal models. So that's a disservice. Now, recreational versus medical. I am actually not an advocate of recreational use. Just being a physician, I know what the worst that can happen with improper use of marijuana is. And there are definitely certain populations that shouldn't be using marijuana. So that is a concern for me. If anybody can just walk in, they use excess amounts, then they are likely to get side effects of the marijuana. So what I'm an advocate of is the medical use of it, but I'd certainly like to see more research.
So I treat a lot of patients who have like the diseases that you're talking about, multiple sclerosis, ALS. I treat a lot of patients who are suffering from cancer. And one of the main questions that patients come into my office and ask me about is the effectiveness of CBD oil versus, just straight oil that has THC in it. And so what's the difference between CBD and THC and its effectiveness on cancer from what you've seen so far?
Okay, so specifically when it comes to cancer, do you mean when it comes to anti-cancer properties or are we talking about side effects of chemotherapy?
First, the anti-cancer properties, and then secondly, the side effects of chemo, like nausea and then the lack of appetite.
Okay, sure. So anti-cancer properties. So marijuana has been shown based on research done in test tubes and petri dishes and in animal models that marijuana does have anti-cancer properties. And it's working in a couple ways. One is that it's is reprogramming cells for apoptosis, right? So So in more simple terms, basically cancer cells forget to die. And so they keep on just, making numerous copies of themselves. So marijuana comes in and kind of turns the switch back on for cell death. It reminds it that, hey, your time is going to be up soon. So you need to stop replicating yourself. That's one way. The second way is that it targets what's called angiogenesis. So tumors have blood supplies, and the growth of the blood supply to the tumor is known as angiogenesis. So it's specifically targeting the blood vessels that are supplying the tumor. Third way is that it also impacts cancer cell migration and invasion into other organs as well. Now, here's the important thing to remember, though. This is research-based in animal models. In humans, we certainly don't have enough information. I believe there's been one pilot study done in patients with glioblastoma multiforme, but this was a population of about 9 to 12 patients, so you can't really draw any solid conclusions from it. But there's a lot of information on the internet where people are making claims that, marijuana cures cancer. And as a physician, even having seen patients clinically, I wouldn't make this claim. Especially because what concerns me is that, especially with chemotherapy, when you do have evidence that shows that there is a high likelihood of success with this treatment in treating the cancer, but yet, despite knowing that, you put your eggs in the basket of using cannabis to treat your cancer, you're doing a huge disservice to yourself, right? You're taking a huge risk, and the cost of that risk is that it can cost you your life. So that's the anti-cancer part of it. Now, when it comes to side effects of chemotherapy, a lot of the common side effects are nausea, vomiting, loss of appetite, and also long-term neuropathy that results from chemo and radiation treatment. So I have had a lot of success in treating those conditions. Patients are able to, it helps to reduce their nausea, eliminates vomiting, and it stimulates their appetite. So we don't have a lot of medications that we can use to stimulate appetite in cancer patients, and this is one of the medications that we are able to use. And patients are able to, food tastes better to them. Well, it doesn't taste better, but it doesn't. A lot of times patients are repulsed. When you're undergoing chemo, you're just repulsed by the taste of the food. So they're able to the taste is better, and also they're able to keep the food down as well. There's a desire to eat as well. The other thing is that with the neuropathy, it helps to reduce their pain. And they don't necessarily have to use typical prescription medications like, for instance, gabapentin or opioids to help relieve that pain, and they can do it just with the medical marijuana.
Gotcha. Okay. Now, why, from what you've seen, why should somebody choose medical marijuana over a typical pain prescription? Why would they choose that over that?
Couple of reasons. And a lot of these reasons are reports from my patients, right? So they'll tell me things like, the medication's not working for me. It's just not working. The second thing is that I'm experiencing side effects from these medications. So with opioids, a lot of the common side effects that patients tell me about are constipation, nausea, vomiting, dizziness, feeling lethargic. Third thing is that there's a concern of addiction. So these are the three main reasons I have patients coming to me looking for an alternative to prescription medications.
Gotcha. Have you found that marijuana is not addictive?
So let's talk about that. So it certainly has a potential for addiction. Okay. It comes down to how you're using it. There was a study done, I think this was in the early 2000s, where they they basically surveyed heavy users of marijuana. These were users that were using marijuana on an almost everyday basis, and they did admit to using marijuana to get high off of. A lot of times they were even using it multiple times in a day. And what happened was that they found an addiction potential of 9%. So I think mathematically that comes down to 1 out of every 11 people.
Wow.
Okay. Now, alcohol, the potential for addiction is 1 out of every 7 people. And the baseline that they used was that this was anybody who drank on average more than 12 drinks in a year. So the potential for dependence was 14%. Tobacco, for anybody that used tobacco on an everyday basis, the dependence was 24.1%. So 1 out of every 4 people. So it's certainly a lot less than alcohol and tobacco, but there is a potential for addiction. It always comes down to how you're using it, right? So the example that I always give my patients is a glass of wine a night versus a case of beer a night. You know, you're more likely to get addicted to the case of beer a night. And when I guide my patients on using medical marijuana, what I'm emphasizing is lowest effective dose and minimal frequency. So you're not taking more than you actually need.
Yeah, I know. I remember a quote, going through school, and they said everything is a poison. It just depends upon the dosage.
Yep.
I've seen people get sick by drinking too much water. You heard that, but one, I guess hazing that was done where the guy died because he drank like 21 gallons of water in a few hours. And like everybody that's listening, I think that that makes a really good point. Is everything can be used for your benefit, but that same thing can also become your detriment as well. And it really is a shame that marijuana has gotten such a bad rap, and you've shed a light on why that is, and ultimately it comes back down to historical perspectives and chasing the money trail as well. But I want to end with this. What should a person? Well, 2 questions. Why should a person come into you to get this done? And what questions should they ask you when they're in there that they don't necessarily ask?
Sure. So as doctors, we're problem solvers, right? So people are coming to us with a problem, and our job is to help them solve that problem. So the patients that I'm able to help are the ones that are struggling with chronic pain, with insomnia, with anxiety, and conventional treatment is not helping them. Even some other alternative treatments are not helping them. And that's where I have the potential to help them, because for these 3 conditions in particular, I have found that medical marijuana does a better job than pharmaceutical medications in terms of treatment. Now, in terms of the information that people should be getting from a medical marijuana doctor, I'm going to walk you through a list.
Yeah.
Number 1, the doctor should be walking you through what combination of cannabinoids are best suited for your particular medical condition. Let me give you an example.
Okay.
In the case of anxiety, based on research, based on my clinical experience, I found that higher amounts of CBD tend to benefit the patients a lot more. And high amounts of THC will, in fact, worsen the patient's anxiety, even cause paranoia. So we don't want to make the condition worse. So that's why that's important. Second thing is that I mentioned a couple methods of use. There's a lot more. And certain methods will work better for certain conditions than others. So that's a second piece of information people should be getting from their medical marijuana doctor. Third is figuring out how much to take, also when to take it and how often to take it. And then last thing is that just like any other medication, if marijuana, if you take too much of it too often, it can cause side effects. So it's important to know what these side effects are, how to avoid the side effects, and then most importantly, what to do in case you do get side effects from it. So these are all the pieces of information you want to be getting from either your physician or from a medical marijuana doctor.
How do you guys determine dosage?
Okay, so dosing here's the thing, it's a fat soluble medication, right? So just like vitamin D. So what I'm walking my patients through is that I'm not giving them, take this many milligrams this many times a day. What I'm walking them through is a methodology for them to figure out, where they fall within that therapeutic window. So that's essentially how I'm helping them figure out dosing.
Okay. Wow, I learned a lot. I thought I knew stuff, but I learned a lot. Thank you so much for shedding a lot of light on this topic.
Yeah. Thank you for the opportunity for me to share this message.
You're very welcome. Where can people find you on the internet?
So a couple places. My website is one, and the website address is drrachnapatel.com. And doctor is abbreviated DR. Rachna is spelled RACHN as in Nancy, APATEL. So that's one place where you can get information. The second place that I put out information is on my YouTube channel. And as well as on my Facebook page. And basically what I'm trying to do is I'm trying to answer a lot of the commonly asked questions, alleviate a lot of the fears surrounding marijuana. And so if your listeners have questions, they're more than welcome to post their questions in the comments section, either on my Facebook page or on my YouTube channel, and I do eventually get around to answering a lot of the commonly asked questions.
That's awesome. So I'll have that all linked up in the show notes, all of your social media outlets and all that kind of stuff. So it was great having you on the show today, and thank you for all that information.
Yeah.
Well, there you have it. Hopefully you guys learned something from this episode. I know I did. A lot of the misconceptions surrounding marijuana was cleared up, and that the stigma surrounding that of people abusing it and getting high, and it not being a useful source of medicine, it's just not true. I've seen more harm done from people using prescription drugs and painkillers and abusing those things than I have seen with the proper use of medical marijuana. And just like anything else, when you use it responsibly and when you use it for a specific purpose and it's not used to abuse or being abused, you're gonna get good results. And I just want to thank Dr. Patel for sharing her knowledge with us and being with us today on the show. And if you liked what you heard today, please share this with your friends and family. Email this to them. Share this on your social media. If you have any questions, you guys can email us at info@whatupdocuniversity.com. If you guys have any questions about the show, if you guys have any comments, go ahead and email us, or you can hit us up on any of our social media feeds. And we'll get back to you. And again, guys, loving all the 5-star reviews. Shout out to all of those who are taking the time to review the show. And if you find this show valuable, please leave us a 5-star review. That's how we can increase our listenership and spread the message of health to the rest of the world. So till next time, I'll see you again. Be well and aloha.